everyone, I'm Christelle Kay, and as promised, we are here with Dr. Suzanne Trott in her offices here in Beverly Hills. First of all, Suzanne, thank you so much for meeting us.
Oh, you're welcome. No, this is really fun. This is great that we get to talk.
Well, let's go ahead and get started. First of all, why did you choose to become a plastic surgeon?
Well, I think, when I was rotating through the different surgical rotations in medical school, it was the field that afforded the surgeons the most creativity. My mom's an artist. I am kind of an artist, I guess, and there's a lot of out-of-the-box thinking involved, and applying basic principles to different situations, no two of which are the same, really, in plastic surgery.
Okay, so here in Beverly Hills, we have some of the most plastic surgeons, I would think, in the country. Many of them are probably going to be men. Now, how does going to a male plastic surgeon versus a female plastic surgeon like yourself, how does it differ for the actual patient?
Well, personally, I think for the things that I specialize in, which is mostly women's breast and body contouring, I think the advantages I have are not just as being a woman, but being a woman who is body conscious and in touch with what women are going for, the looks that they're going for, and which is not necessarily something to impress a man. Okay. I think that men see women's bodies differently than women see women's bodies. I mean, we women know that. We know that we're not doing these things because we think it's going to make a man like us better. It's something that makes us feel better about ourselves based on things that we see, and ways that we want to look. So I think that having...
Does that explain just really quickly, when I tell my husband I don't like this about myself, he doesn't know what I'm talking about?
Yes, that
okay.
totally explains
that makes sense.
it. Yes, that totally explains it, because I can have a woman come in, like a common one is, for instance, a lot of women want to do liposculpture of the thighs, of the inner thighs, and they say, well, am I going to have a space between my legs? I mean, that's a big thing. A lot of women say they want to have a space between their legs. Like, models walk down the runway, they have a space between their legs. And a lot of men would look at you and say, why? Why do you care? I mean, what does that have to do with anything? And it doesn't really have to do with anything, except that it's something that women perceive as attractive. And so I think, I can show before and after pictures to my husband of a woman whose thighs have been perfectly sculpted, and he'll look at them and he'll see, the saddlebags are gone, and he won't see a difference, and he'll just be like, what's different? Because he's looking at her waist, he's looking at her breasts, he's not looking at the things that we look at.
So would you almost say that you're kind of like your girl's best friend and a plastic surgeon together?
I am. It is very easy for me, feeling the same things that my patients feel, to be able to get on the same page with them about what it is that they want. Everybody has an ideal for themselves. The ideal, a girl who hangs out with bathing suit models in Miami, has a different ideal for herself than I have for myself, than someone who has had, a big weight loss operation and has a lot of extra skin. Everybody has something that can be improved. And I think being able to see the potential that's there for each and every person, I think that's the advantage that I have.
Okay. Now, I know you can't tell us which celebrities have had what done, because I wouldn't ask you to do that, but can you just tell us maybe the hottest procedures that you're doing right now, and what the most popular ones?
Well, the most popular procedure in plastic surgery has always been, and probably always will be, liposuction or liposculpture.
Now let's go back. You said liposculpture. I've heard of liposuction, but what is the difference between liposuction and liposculpture?
Honestly, liposculpture is a more user-friendly term. Okay. It sounds less invasive sculpting. But whatever I do, I would consider it to be liposculpture, because I'm not just taking out fat. I'm always sculpting it to the way I would feel like I would want it removed on me in certain areas. So it's really the same thing.
Okay. Now, I've been doing a little bit of reading on liposculpture and liposuction now that I know the difference, but I guess some questions for you. How painful is it?
It's different for everybody. This is the kind of thing, I give everybody really good pain medication, and I tell them up front. Right. I would say for most women who exercise a few times a week, okay, you probably need to take at least a few days off of work, okay, at least, and it feels like you've worked out really, really, really hard. Okay. That's what it feels like. It feels like you've worked out really, really, really hard, or run a marathon or something. But you haven't, obviously.
Okay.
Most women are up and around pretty quickly afterwards, but everybody's pain threshold is different. So I just like to prepare them, tell them a week of no obligations. That's not a week in bed. That's a week of, you don't have to be at this meeting. You don't have to be at this thing or that thing, but you can get up and do something if you want to.
Okay, so you're basically equating it to working out really, really, really hard, maybe some soreness.
Yeah.
Afterwards.
Yeah. It's more soreness. It's not agonizing pain. It's really just soreness. It feels like you did like a million sit-ups or something.
A million sit-ups.
A million sit-ups.
How about half a million sit-ups?
Half a million, maybe.
Half
I don't know.
a million
I haven't done more than like 2 sit-ups in the past decade, so I don't know how long it would take to do half a million sit-ups.
All right.
But yeah.
Now, as far as the results, is it permanent? Does it go away? If we get liposuction, does that give us a whole reign of food that we can eat, like limitless?
No, people always ask, is it going to come back? Is it going to come back weird? Is it going to come back lumpy? I mean, I will tell you from personal experience, myself, as well as, my patients, where I've been in practice for, almost a decade. If you take care of yourself afterwards, it really doesn't come back. I mean, it is a permanent solution. However, it is not instead of dieting and exercising, and especially women who are in their 30s, 40s especially, your metabolism changes. You might have to kick it up a notch. You might have to eat dessert less times. You might have to work out a couple more times a week. But it should not come back if you take care of yourself.
But you can actually reward yourself with new clothes.
Absolutely, and you should.
Okay.
And that you should definitely edit out the clothes that do not fit you, because you won't reap the benefits of your procedure, and then you won't be able to see yourself as your new self. And people sometimes could carry around an image of themselves as they were before, and you really need to enjoy it and experience it. So I tell people, like, if I've done a liposculpture on them, and they come in wearing their baggy clothes from before the surgery, I tell them they have to come back in a tight outfit. Like, I will not see them until they come in.
Good advice.
Form-fitting, yes.
And no dessert. And then as far as how long should we expect until we see results? So I come to get a surgery or the procedure from you, and I've got the liposuction or liposculpture. How long or how quickly do I see a result?
Well, usually you can see something right away. I mean, a lot of people don't want to look right away because there is some bruising and swelling. It depends how much we've done. Some people, you notice a huge difference right away if it's a lot from one area. Okay. It's very obvious right away. I usually tell people the swelling really starts to go down at 2 weeks. 6 weeks, it's pretty much the way it's going to be, but 3 months that's how it's going to be. So I mean, I really like to be very honest and upfront with my patients. I do the very best job that I can. I take off as much as I can, within reason, and but at 3 months, that's how it's going to be. So I don't carry on for months. It's just swelling, come back in another year. I mean, at 3 months, that's how it's going to be. And you should really see your result within a couple of weeks.
Okay. Well, 3 months is great, because for those of us who have reunions coming up, we kind of can plan it
accordingly.
So we're going to make sure that we look our best.
Yeah.
Now, you talked about liposculpture. What are some other maybe new techniques or new procedures that are happening right now?
Well, I would have to say, Christelle, that the hottest procedure right now is the autologous, or your own fat transfer, the liposuction fat to the breast. So breast augmentation with your own fat. Yes, it is a dream come true.
So for the fat injection to the breast, when should we expect to see results? Is it also like the 3 months as in liposuction?
Yes, but unfortunately it goes in the other direction. So it starts out, they start out very swollen with fluid, post-operatively. They're just swollen, like everything's swollen. And they do go down.
So we shouldn't get excited like the next day.
They get excited. Sometimes they get scared. And I tell them, I'm like, listen, I can't possibly make you too big with this operation. If I could make somebody too big with this operation, I'd be retired. I mean, so I would say about the same. About 3 months is when the swelling is pretty much down, and the volume, and what fat is going to take has taken. But then again, they do fluctuate with your weight. So if you gain weight, they can get bigger, even bigger than they were. And then, I've had one patient who trained for a marathon, and then they got smaller for a while, but then when she got back to her baseline, they were bigger again.
Okay, so we talked about liposuction and we talked about the fat transfer, which is amazing. But some of us out there or out here may not be ready to go under the knife just yet. Maybe we're on the cusp, maybe we're thinking about it. What could you recommend to those of us who want to improve our look, but we're not ready to go under the knife just yet?
So obviously for the face, when you're talking about rejuvenation of the face, you're talking about Botox and fillers and things like that. So one thing I've done with fillers is use them to fill in small areas of cellulite on the body. Because a lot of people ask about what can I do about cellulite. I mean, whoever has the real true answer to this is going to be the world's first trillionaire, I always say.
Hopefully it's you.
Yeah.
So again, thank you, Suzanne, for joining us today. So again, Dr. Suzanne Trott here in her Beverly Hills office. Again, she can make us all look our absolute best. Thank you for watching.